There's no doubt that I would not have children. There's no doubt in my mind that without the transplant, I would not have Elizabeth and Aaron.
Faith Carlin's journey to motherhood began with life-threatening health issues, a result of a 15-year struggle with diabetes.
I didn't realize what a toll it was taking on my body. They were telling me that I could go blind, and my kidneys were failing, and I would need dialysis.
At age 30, doctors recommended a combined kidney and pancreas transplant.
I knew nothing about organ donation. I never heard of a transplant before that day that I talked to my nephrologist.
Faith was added to the national transplant waiting list. With dialysis looming in her future, she got the call. A young man had died, and his family donated his organs.
I remember going into the surgery and handing over my insulin pump and saying, "Please be careful with this. I may need this again."
Several hours later, Faith emerged from surgery.
The next thing I remember is waking up to my mother singing. I said, "Mom, did I have the transplant?" And she said, "Oh yeah." She said that everything was great, that you know, my kidney was already working, my blood sugar was already normal, and it couldn't be better. And you know, we just cried together.
For most patients awaiting transplants, the journey back to health begins here at Gift of Life Donor Program, which coordinates organ and tissue donations in Pennsylvania, New Jersey, and Delaware.
John, I hear you're working on the local case.
Oh, yes, I am.
Can you go over the donor with me?
Sure. It's a 31-year-old male Caucasian.
The reason why Gift of Life exists is because there's people who need an organ for transplant. There's that waiting list that people talk about.
Howard Nathan has been with Gift of Life since 1978. Today, he is considered one of the world's leading experts in organ donation.
Right now, there's over 6,000 people waiting for a call so that they can get back to a normal life through organ transplantation. In 1974, when the program started, it was really just about kidney transplantation because that was the only organ being transplanted.
Dr. Clyde Barker, past chair of the Department of Surgery at the University of Pennsylvania, was one of the co-founders of Gift of Life, originally named Delaware Valley Transplant Program and known largely by its phone number, Kidney 1.
In the beginning, one might get a call from a doctor at another hospital, perhaps a transplant surgeon, or perhaps another doctor who had a patient that was dying and in whom it had occurred that that patient might become a donor. One would quickly get a team organized and go to that hospital and wait around and talk to the family and do the other things that are now done very efficiently by Gift of Life.
It was very rare. Most people didn't understand it.
Dr. Aaron Bannett, who started the kidney transplant program at Albert Einstein Medical Center and co-founded Gift of Life, recalls the early days of organ donation.
It would just be an occasional thing. But you had some wonderful people who were really very generous about it and understood brain death, and they wanted something good to come out of the potential donor. And that was the beginning of it all.
What began as a pioneering effort to save lives through kidney transplants evolved as doctors began transplanting other organs and demand for transplants grew.
When the program first started, it was just one transplant coordinator and then a secretary. That was the entire program. And as the program grew, I was the 4th transplant coordinator that was hired. The roles of the clinical aspects of the program changed, particularly when we started coordinating heart and liver and lung transplantation, from a kidney program to a multi-organ transplant program. But the bottom line is, the success or failure really depended upon the frontline people who would get that referral and get that consent from the family.
Cynthia London represents one of those families. Her life intersected with Gift of Life Donor Program after the death of her son, Sipo.
All I saw at that point was my healthy son lying up there, and this horrible thing was happening, and there was not one thing I could do about it. A coordinator from the Gift of Life came in and began to talk to us, to the family, about what our donation was going to be. The Gift of Life coordinator was so compassionate with us and letting us know that we were going to be helping other people who was waiting.
Sipo's organs were transplanted into 6 people, including George Flacco, who received Sipo's heart. Cynthia's and George's families met through Gift of Life after corresponding for several years.
I always said that Sipo was my gift, and he would bring hope to the world. And he brought hope to 6 other people. And that's his legacy.
Gift of Life is the largest of 58 organ procurement organizations in the U.S. The program has led the nation in organ donations for more than 2 decades, due in large measure to the passage of a law called Pennsylvania Act 102.
It was signed December 1st, 1994 by Governor Robert P. Casey, who many recall had a liver and heart transplant in Pittsburgh.
The law required hospitals to contact Gift of Life each time a patient died, created a donor registry through a driver's license program, and provided funding for education.
In 3 years, organ donation in Pennsylvania went up 43%, when organ donation in the rest of the country was only up 2 or 3%. So clearly this was seen as a model law and a model provision for hospitals to call at or near the time of death, and to mandate that organ procurement organizations are a key component of the requesting process. That then became a federal regulation in 1998, and now is the law of the land in the United States.
Building public support for organ and tissue donation has also enabled Gift of Life to help save more lives.
There's a lot we've done over the years to educate the public about donation. From the early days where we did pretty rough public service announcements.
Do you know me? Most people don't recognize me because I'm not a famous person.
To people like Michael Jordan, to sophisticated TV commercials from the Ad Council, or nowadays with our state health department advertising.
or calling 1-877-DONOR-PA.
Gift of Life's outreach into multicultural communities, sponsorship of events like the Dash for Donor Awareness, and participation in the U.S. Transplant Games have helped keep public attention focused on the success of organ transplantation and the need for organ donors.
What amazes me about the Gift of Life is that, and I've watched this over the past 35 years, that the organization has marshaled the resources at the community level, at the institutional level with hospitals, at the political level and advocacy level to really make organ donation and transplantation part of the community fabric.
Today, Gift of Life Donor Program draws medical professionals from around the world to the Gift of Life Institute for training and educational programs. And to serve an unmet need for families of patients who travel to Philadelphia, the donor program is developing Gift of Life Family House, which will provide support and affordable lodging while they await transplant.
Gift of Life has achieved so much in the past 35 years. We've performed more transplants than anywhere else in the United States and probably anywhere else in the world. And the reason is this community has accepted donation and transplantation as part of their responsibility. We're very proud of that.
And for Faith Carlin, the proof of Gift of Life's success and purpose of its mission is simply stated.
I think I do owe part of my life to Gift of Life, just all that they do to result in lives being saved. And yeah, I do thank them for my life.